Hi, I'm Dr. Charles Lick, Medical Director for Allina Health EMS. Thanks for joining us today, and this training video will highlight two important concepts: Pit Crew CPR and some new recommended changes to CPR performance. The Take Heart America program has showed us that a systems-based approach can improve care from cardiac arrest. In fact, we more than doubled survival in 2 Minnesota communities with this systems-based approach. That success has now led to a national program, Heart Rescue Project, sponsored by the Medtronic Foundation. In that program, 6 different states across the country are implementing a similar systems-based approach to cardiac arrest care. Pit Crew CPR helps bring order to the chaos of a cardiac arrest, and the Minnesota Resuscitations Consortium, part of the National Heart Rescue Project, has recently recommended some CPR changes that will improve care.
Number 1 is continuous chest compressions. Number 2 is the focus on early defibrillation. This really has not changed. 3 is use the rescue pod, the impedance threshold device, if it's available to you. The other change is to have asynchronous ventilations for 2+ rescuers. So if there's only one rescuer there, you can still do 30 compressions and 2 breaths. But if there's 2 or more rescuers, we want to focus on continuous chest compressions and asynchronous ventilation. So the ventilations should not be in a 30-2 fashion, but 8 to 10 breaths per minute. The other recommendation is a lot of the new science has shown that we need much less oxygen. So the recommendation from the Minnesota Resuscitations Consortium is to start with oxygen at 4 liters per minute and then titrate to an O2 sat when advanced life support arrives. And really the last recommendation is it's okay to delay ventilations until help arrives if you're only a single rescuer. So for a single rescuer, just do continuous chest compressions until help arrives, usually in 3 to 4 minutes. If help is delayed, then you should start ventilations at that point in a 30-2 fashion. So now let's talk about this Pit Crew CPR concept. This is not new and it's been around for a while, but recent studies have shown better performance and better outcomes when everybody knows what their job is. This is all based on auto race car pit crew concept, where everybody's got a specific job to do and they get an amazing amount of work done in 10 to 15 to 20 seconds or so. So we can correlate that with this Pit Crew CPR concept where everybody's got a specific job to do. Here we have a graphic showing a triangular approach to the patient for this Pit Crew CPR concept. So here's a video focusing on single rescuer Pit Crew CPR. The officer's checking for responsiveness, starting chest compressions, continuous chest compressions immediately. Now you notice he's focusing on getting his hands off the patient to allow full chest recoil. This helps augment the negative pressure in the chest on the upstroke, which sucks more blood back to the heart, which results in more effective CPR. Now we want to go to early defibrillation as soon as possible. For every additional minute that goes by before you shock the patient, the chance of a successful defibrillation drops by 7 to 10%. So we want to get the AED on as soon as possible. After the shock is delivered, the officer goes right back into continuous chest compressions. And for single rescuer, it's okay not to do any ventilations for the first 3 to 4 minutes. There's enough oxygen dissolved in the patient's bloodstream where we want to focus on chest compressions and moving that blood around. Here's a video depicting 2-person Pit Crew CPR. First rescuer is on the patient's right, checking for responsiveness, starting continuous chest compressions right away. Remember, get your hands off the chest, allow the chest to fully recoil to maximize the blood flow coming back to the heart. Second rescuer is on the patient's left side and places the AED as soon as possible. Also, the second rescuer is placing an oral airway, a tight-fitting face mask with a strap if possible, and if you have the rescue pod, attaching that also. Remember, the rescue pod helps augment blood flow and sucks more blood back to the heart on the upstroke of CPR. We are now doing asynchronous ventilations at a rate of 8 to 10 per minute. If you have the rescue pod, 1 hand squeeze of the ambu bag every time the timing light goes off. They are now ready to defibrillate as AED is analyzing the rhythm, And of course, we don't want you to touch the patient. This will interfere with the analysis from the computer in the AED. AED calls for shock. They go ahead and shock the patient, immediately switch roles, and now rescuer 2 is doing continuous chest compressions at 100 beats per minute, and rescuer 1 takes over the airway. Now, as we see on this graphic, if there are 3 responders, we want rescuer number 1 to be at the patient's right side performing continuous chest compressions. Number 2 is on the patient's left side and applying the AED and alternating compressions with rescuer number 1. And rescuer 3 is at the head of the patient applying the impedance threshold device or rescue pod, oxygen at 4 liters per minute to the bag valve mask, and asynchronous ventilations at 8 to 10 times per minute. So here's one of the best ways we found to apply the Lucas mechanical CPR device. Once again, you want to be doing continuous chest compressions, so limit your chest compression interruptions to 10 seconds or less for any maneuver, Lucas, airway, shocking if possible. So with continuous chest compressions going on, we first want to place the backboard. And one of the easiest ways to do this is to straddle the patient and lift the patient up, bending at the waist by their arms, and the second person then places the backboard under the chest. Continuous chest compressions are then resumed, and then the first person goes back and places the Lucas, lowers the plunger to the chest, and turns on Lucas. Only then do we stop CPR and start with mechanical CPR with the Lucas device. Remember, continuous chest compressions at all times when possible. Limit chest compression interruptions to 10 seconds or less. Lift the patient up, bend them at the waist to place the backboard. Restart chest compressions while Lucas is applied, and only then do we stop chest compressions when Lucas is turned on. So to recap, the Minnesota Resuscitation Consortium BLS protocol recommendations are as follows: continuous chest compressions whenever possible, early defibrillation, apply the rescue pod if it's available to you, asynchronous ventilations for 2+ rescuers at 8 to 10 times a minute. So that means if there's 2 or more rescuers, we do not do 30 to 2 compressions. We do continuous chest compressions with asynchronous ventilations. If you have oxygen, apply it at a lower rate, only 4 liters per minute to start. And for single rescuer CPR, it's okay to delay ventilations for the first 3 to 4 minutes until other help arrives. If help is delayed, then after 3 to 4 minutes of continuous chest compressions, go ahead and start 30 to 2 ventilations.
Thanks for joining us on this training video, and let's go out there and save more lives.